is Susan Howards, and I'm a local attorney in Brookline, Massachusetts. I'm filling in for Steve Bressler on this, The Safety Net, Brookline Access Cable TV show dedicated to providing resources, information, and interviews on the subject of domestic violence. With me today is Julia Campbell, a researcher at Boston Medical Center and Boston University. Hello, Julia. Thank you for being with us.
Hi, thank you for having me.
Julia, could you give us a little bit about your background and what you do?
Sure. So currently I work at Boston Medical Center and Boston University, like you said. Few years ago, back in like 2014, 2015, I started working at a shelter for survivors of domestic violence that was up in Burlington, Vermont. And that is how I began my career in this topic. And so since then, I've done a few different things, but I just finished my master's degree where I studied epidemiology. So I do public health research and I focus on violence prevention, gendered violence. So this topic of domestic violence is near and dear to my heart, and I'm happy to talk about it with you today.
Julia, thank you so much. I would like to just share with you, I received some information from a realtor, Betsy Mullane, Sotheby Gibson, and it was from the World Health Organization, and I'm not sure that you must be familiar with this. According to their data, within 3 months of the shutdown due to COVID, there will be 15 million cases of domestic violence. If it goes on for 6 months, there will be, this is worldwide, obviously, there will be 31 million cases of domestic violence. And if the shutdown, meaning stay-at-home orders, continues within, 1 year, there will be 61 million cases of domestic violence. Do those stats seem reasonable to you?
I mean, they are stark predictions. They're basically predicting that the rate is going to double every 3 months. So, you know, I think it's hard to predict, but I would agree that I think that the rate of domestic violence is going to increase. You know, I can't exactly forecast exactly at what rate, but you know, that doesn't surprise me a whole lot. We know that right now already 1 in 3 women in the United States and 1 in 6 men in the United States, that's just the US, experience domestic violence at some point in their life. And so, you know, that's 33% of women. So if that increases, then we're still talking about staggering numbers. And, you know, I do agree that it's probably only going to go up.
Why do you think that COVID is going to increase so rapidly during COVID? Is it because the, I want to say victims or survivors, those involved in a domestic abuse situation or domestic violence situation are receiving a double whammy? They're isolated by the abuser, and now they're even isolated by the virus. The fact that we have to stay home, they can't go to work, there's no daycare for their children. Why do you think it's more pronounced now?
Yeah, that's a really important question. I think you're exactly right. I mean, there's a couple of reasons for this. First of all, people are just simply exposed more. There's more time for people to experience violence because they're spending more time at home with their partners. And so isolation is definitely a huge piece of it. Like you said, isolation is commonly used even in times of non-COVID. And, you know, it's a technique that abusers can use to prevent their partners from having social relationships, which we know are really helpful and really protective for people that need to get out of a relationship or cope with a relationship. And so with social distancing guidelines and restrictions, you know, nobody is really able to talk to their family or friends. And so abusers may find it easier than ever to keep their partners from accessing help and resources. And then we know that there's just a lot of general stress that's coming along with this pandemic. You know, people are losing their jobs. There's a lot of financial strain. And again, in normal times, that is associated with increased rates of violence. And so we can imagine that with the economic crisis that we're facing right now, it's just exacerbating any, all the stress that might be related to violence. And I've also heard of ways that abusive partners are using the virus and information about the virus to control partners. So, I've heard about people, one thing would be preventing survivors from accessing medical care, using misinformation about the virus to scare people out of making doctor's appointments, or seeing a provider that is somebody that they might normally disclose to or seek help from. I've also heard of people, threatening to bring COVID home, as a way to maintain control over their partners. And so being up to date on like the facts about COVID and your specific health condition might be a really empowering tool for survivors right now.
What other ways are they interfering with access? Because we have a lot of resources, particularly in Brookline. We're very fortunate. The police department is amazing. The Domestic Violence Roundtable, other organizations in Brookline, Reach Out, Brookline Mental Health Center, Women Thriving. What other ways are abusers preventing access to these resources? And Julia, if you would, how can the survivors, reach out and gain access to the many resources we have?
Yeah, good question. Well, first of all, shelters are facing a lot of challenges right now. Most shelters are at capacity or are having to sort of get creative with remote ways of providing advocacy. And so I think one major way that abusers are preventing survivors from accessing resources is through technology. So we are stuck at home, and you and I are on Zoom right now. It's sort of become the only way to stay connected. And when you're at home with somebody, you're stuck at home with somebody, it's really easy for that person to maybe monitor your phone calls, your texts, what websites you're going to, who you're video chatting with, especially if you can't go outside. And so I think that we've actually been getting reports of reduced call volume and reduced police reports to shelters across the country. And I think that this is because survivors may not be able to reach out. There may not be a safe way for them to use technology to reach out for help. So one recommendation that I have is, being savvy with your devices. You mentioned all these great resources that are accessible to survivors. And so if you're going to look it up on the internet, use an incognito browser, or make sure that you sort of like clear your browser history in a creative way. Maybe don't clear the whole history, but if you can just clear like the day or something, so it's not suspicious. Keep a password on your phone. If your partner wants you to give them your password, make sure that you're like deleting specific text messages, deleting specific calls. You don't want to alert your abuser to the fact that you've been reaching out. And if you're in a position where you can talk safely to a friend, there's one of my favorite things is the code word trick, I like to call it. So coming up with a code word or like a fake phrase that might alert a friend or family member or somebody that you are able to stay in touch with, that you're in danger, that you might need them to give you a call, to intervene in a situation, to sort of like break up a moment, or to call the police if you are in feeling really threatened. So, if you have a relationship with your neighbor, for example, you could say, if I text you and say I'm, baking a cake and need to borrow a cup of sugar, that means that I need you to help me. Or if you have a friend and you want to text them and say, like, I'm interested in buying the hammock that you're selling, stuff like that, sort of fake things that wouldn't alert your abuser to what you're doing, but that you have an understanding that this means I need help right now.
One of the things we're trying to do in Brookline is to involve more of the community of the essential businesses that are open, like pharmacies, like grocery stores. And we're trying to educate the people who work in those places that if somebody comes in and hands you a note, help, I'm in trouble, it is usually a domestic violence situation, and get them some help. The first thing we will expect is to call the police, but in some instances, Julia, that only exacerbates the situation. Yes. It makes it worse. So what would you suggest to people who are handing notes to strangers? Should they include who to call, where to call, safe link, numbers? Give us some ideas of coping strategies with resources that are available, because oftentimes they do go to the grocery store to get the supplies for the family.
Yeah. I mean, first of all, survivors are the experts of their own situation. And so there may not be a one size fits all. You know best what you need. And so if leaving the relationship or calling the police is not safe for you right now, then you know that, and trust your gut. But if you do want to, use the technique that you're describing, which I think is a really great creative idea, it might be good to have an idea of a safety plan for yourself first. And so thinking about like what you need and what you want to ask that person for, I think maybe just going in with a note that says like, help me, might be overwhelming for the person. They might first think to call 911, you could, if we could give the number for SafeLink or the National Domestic Violence Hotline, you could put that up on the note and say, like, I'm safe at home. Could I use your phone to call this number? Maybe you can, if your technology isn't safe at home, maybe you can use the phone at the grocery store or at the pharmacy or something like that. So I think, making a plan for yourself and what you need and spelling that out a little bit. But I think people in the community right now are really willing to help. And so I think if you say like, help, I'm unsafe at home, can I use your phone to call a hotline? It might be a safe phone that your abuser cannot access or will not know that you've called. And that might be a good place to start. Or if you are feeling like you're in imminent danger, help, call 911 for me. Might be.
Do you like the SafeLink number since you brought it up? The SafeLink toll-free number is 877-785-2020. And Governor Baker and Lieutenant Governor Polito have made this a priority, and they have designed a hotline that feeds into SafeLink, and you can call 211, and that should give you a link to SafeLink. Also, the Brookline Police, obviously, is 911 for emergency, but if it isn't an immediate emergency, but I think any incident of domestic violence is an immediate emergency, but if it isn't, the number is 730-2222. Domestic violence crosses generations, am I correct? There's child abuse.
Yeah.
Do you want to explain the generational aspects of domestic violence? Elder abuse, child abuse?
Sure. I mean, this is a question that I think we could talk about for like years or something. But basically, I think there's a couple of faces to this. The first thing is intergenerational trauma. If you grow up as a child and you've witnessed trauma from domestic violence or you've experienced child abuse, there are sort of like complicated things that go on in your brain and your body that make somebody predisposed to experiencing violence again, especially if, you know, as a child, you're not really able to learn what it feels like to be safe, or how to distinguish a safe situation from an unsafe situation, or a safe person from an unsafe person. So that sort of like primes people to enter a situation in later on in adulthood that might not be safe, because they might not have ever sort of learned what that means. And, you know, in terms of COVID, I think that this is something that we really need to think about, because kids at home might be at risk of experiencing abuse themselves more, and they also might be at risk of witnessing abuse between parents. And that in and of itself is also a traumatic experience. So, you know, it lasts. And in terms of domestic violence, we're talking about intimate partner violence, but, you know, domestic meaning at home, anybody that's living in the home right now is at risk of experiencing either violence themselves or witnessing violence, which is something that's traumatic. You know, it may also be that somebody as a child has never experienced a healthy relationship, and so may not know what that looks like. And so it sort of cycles. If you grow up in a home where there's violence in the home, you know, you're definitely more likely to unfortunately enter into a relationship later on that is also unsafe for you, and that's not your fault at all. It's sort of a product of the trauma that you've endured that kind of like becomes imprinted in your brain and your body, and it takes a lot of hard work to sort of undo that, but it's possible.
Julia, just in the few minutes we have remaining, tell us a little bit about your research. Where do you get your data? What kind of data are you looking for? And what do you do with the data?
Sure. So it depends on what project we're doing. I'm working on lots of different projects right now. You know, right now I'm working on a lot of projects that have to do with traumatic brain injury and intimate partner violence, which is really important. You know, if you are, I'll just say this, if you are at home experiencing symptoms like of memory loss, or you're feeling like dizzy, or you are having trouble focusing, and you've been hit in the head a lot, or you've been choked, it's not on you. You're not going crazy. You know, you might have something going on in your brain, and you can reach out to a doctor. And so for that, we might get data from shelters. We might do surveys where we ask people, like, have you ever been hit in the head by your partner? For other studies, more epidemiological studies, which epidemiology, I think, is a word that we're all hearing now with COVID. It sort of means population health. We might get data from big databases like the CDC, or the World Health Organization, or the National Intimate and Sexual Violence Survey, the National Violent Death Reporting System. There are organizations that collect big data that we sometimes use. And so it depends. We might get data from people, but we might also collect data from databases.
How do you preserve the privacy of the data that you receive? Do HIPAA laws come into effect? Do you have your own security systems? If somebody wanted to reach out to you and report an experiential episode, would their privacy be protected?
Yeah, I mean, the short answer is absolutely. We take privacy and confidentiality really, really seriously. We usually don't. We always tell people that if they don't want to tell us their name, they don't have to. We don't keep any information about them. And so if we need your name because we need to follow up with you and we need your phone number or your email address, we always keep it in a database that's separate from the answers that you give us. And so even if we need your personal information, we're never able to connect it to the things that you talk about. And so then we always delete our data. And I know that shelter workers, people on hotlines take this really, really seriously too. They are really savvy and trained in the way that they take notes. They have like certain protections in place where they can't be subpoenaed to give up your information, you know, like, so your abuser can't come and say, and like demand that the shelter, you know, give all of the private information to the court or anything like that. And so if you are reporting to a doctor's office, HIPAA applies. I think people that are taking reports of abuse are trained really well in privacy and confidentiality, and that is something that we realize is really, really important.
Julia, we have a minute left. Any last minute words of advice to our audience?
Yeah, I guess if you are experiencing a dangerous situation, or even if it's not dangerous and you're just feeling like this isn't right and you don't feel good and you don't feel happy and safe at home, if you're able to reach out, I think the idea of reaching out to like a local supermarket worker or somebody at the pharmacy is a really good idea. If you're able to reach out to a hotline, I really recommend it. The people on the other end are so kind and they're so well trained to talk to you about your specific situation, no matter what it is. If you just want somebody to talk to, then they're there for that. And if you need somebody to help you make a safety plan about how to stay safe at home or how to maybe get out of the relationship, they're there for that too. The best thing that we can do right now is try to come up with creative ways to stay connected to each other. If you're at home, you're feeling disconnected, just remember that you're not alone and that there are people out there that want to talk to you and want to be connected with you. I know that there's a Reddit page just called Domestic Violence. You know, there are lots of ways that people want to help and stay connected to you. And so if you are able, reach out, because a lot of people care. And I think we're all gonna get through this together.
Julia Campbell, thank you so much. Researcher at Boston Medical Center and Boston University. Thank you again for your information and your time.
Thank you. Thank you for having me.